Our vision in regards to delivering online care for all the residents of the state of Hawaii was that we could use online care to help overcome some issues we're facing relative to access, quality, and cost. And online care really helps to tackle all those issues. Any tool that will help get a medical summary, a medical history, your diagnosis, any procedures you've had, and particularly the prescriptions you may be utilizing is just crucial. And so having a tool like HealthVault that will enable our members, and particularly our non-members, to get that information in front of a consulting physician is so very important.
I think the two obvious advantages of online care are access to care and convenience for the patient. It's an entirely patient-controlled environment. The patient can access the doctor of their choice or their regular doctor anytime they want. They can make a virtual office visit, see the doctor when the doctor's scheduled time, or they can see whoever happens to be online if that particular doctor suits the need or the question that they may have, if it's just something a matter of convenience. The nice part is that the record is there for any of the doctors to see, so they'll be able to see that health record to see what's going on with that patient.
I think patient-provided information is critical for physicians to further understand what they have in front of them. We need to, and I think what HealthVault is doing, and in part what we're doing also, is make sure that all of the different sources of information come together in a concise fashion in front of the physician. When you train in medicine, the first thing they teach you is listen to the patient, they will tell you the diagnosis. So there is great value in patient-supplied information.
Well, I think another great thing about the HealthVault is it does allow for a lot of patient education. There's a lot of information that can be added to the patient's record that the patient can get a printout of. They can take it to their doctor if they're seeing a different doctor online than their regular doctor. They can take it to their specialist. It allows them to print that information out. They can look at it, they can study it, they can try to change their behavior, and then ask their doctor what this means for them and how this interacts with their personal health. So I think having that extra layer of information and education for patients, and that's only going to get bigger as we do more stuff with it, I think that's a great asset to have as part of HealthVault as well.
What we now begin to see through online care and through the combination of online care with HealthVault is that we can use technology not only to redistribute medical information, but rather to actually redistribute medical services. And I think this is very new, this is very exciting.
HMSA sees a very bright future for online care. We are particularly focused on the deployment and the uptake within our own community first. Secondly would be our tourist market. We have close to 6 million people a year who come through Hawaii, about 6 times our own population. And to be able to serve that market as well, so if people traveling through were sick or needed access to a physician, that would be a nice vision we'd like to fulfill someday as well.
I think the focus of HealthVault, really the vision of HealthVault, that it's not just a repository of information, but it's also tying all of these different kind of conduits for that information to be collected, is going to play a pivotal role in its effectiveness. Once we have that information in place, while we know what's going on with the patient at their home, then we need to get in front of the physician, and this is where online care really ties in and allows a care transaction to take place using that information. So I think the term ecosystem is in fact a very good one because it really represents the whole spectrum of information and interaction that needs to place to make it an informed care encounter.
As an early adopter, I think the word to the other physicians is jump in, the water's fine. There's no sharks in here. It's a lot easier than you think, and it's the fear of getting in there and how am I going to stumble around in here. It's very intuitive. It helps you a lot in terms of doing it, and just doing a few encounters and working with either yourself doing it online or getting another doc that you know that's done it, having them show you a few things within 15 minutes of doing that and just committing to that 15 minutes, you'll be able to go online and be able to do this without a problem at all. And every doc I've shown it to enjoys it and can see how they can implement that in their practice very easily.